Ruby Ahluwalia, former senior bureaucrat and founder and chairperson of Sanjeevani Life Beyond Cancer, to please join us on the dais as our moderator for the panel discussion for the evening.
So the idea was with me for a very long time, and this year when I really thought that we should do it, I initially thought of Bombay because I have the resources there, I know people there, and it is so much easier for me. But then I thought, now I live in Goa. Goa is home. Goa is also that place where cancer is increasing at one of the highest rates in the country. So Goa had to be that place. I really had to work at least 100 times harder. But today, looking at all of you here, where each seat has a person here, really makes my life. And I'm so very grateful to each one of you who has taken out time and is here. So thank you so much for that. The way we would handle the next 3 panel discussions, which are here, we would have the first panel discussion on the challenges of cancer, which will be addressed by the eminent doctors who are traveled from all over the country. The second panel discussion would be on holistic healing, as to what all goes into healing a patient, a cancer patient, completely, physically, psychologically, and mentally. So we have amazing people here who are from the field of nutrition, from yoga, from psychotherapy, from quantum healing. I'm really looking forward to that panel discussion. And in the third panel discussion, you will be listening to those who have gone through this experience of cancer, have come out of it or coming out of it, what has been their experience, what worked for them. So that is how we will try and take that direction in the panel discussion.
Ladies and gentlemen, it's my privilege to introduce our esteemed panelists who will lead us in our first discussion today, addressing cancer challenges. These visionary leaders have dedicated their lives to the pursuit of excellence in cancer care. And also we have with us Dr. Sandeep Jasuja, Medical Superintendent of State Cancer Institute, Jaipur, whose leadership has been instrumental in expanding access to quality care in Rajasthan. Dr. Jasuja, your dedication to improving cancer care is truly commendable. Welcome, sir.
Dr. Jasuja, there is one thing which I really want to ask, and it keeps bothering me. We talk so much about stress having a negative impact on anybody, more so on a patient. And when a patient comes to the doctor, first thing he wants to ask, because उसने बहुत जगह से सुन लिया है कि what is my stage of cancer? Yeah. I understand, and that is what I get to know from a lot of doctors, that we need to tell the patient the prognosis, which could be negative. Now, when a doctor tells a patient that your prognosis is negative, आप 4 महीने जिएंगे, you will live for 6 months, what are we doing? What are we trying to achieve? Are we doing the right thing? Or is there some way to manage this in a way that I understand the ethics of the medical practitioner remains, but also the positivity of the patient to work on himself or herself doesn't go away? What do you think, Dr. Jasuja?
First of all, let me congratulate you and I for this kind of unique kind of conference and meeting, because really this is the need for our society and for us to interact all our years, because we are very busy doctors and we sometimes don't interact with another specialty what rightly mentioned with my fellow colleague Ashish and really and I was thinking about same thing कि जब हम लोग पेशेंट्स के डिस्कस करते हैं and I feel this first of all let me just have a comment on this and I will come to your
Yes,
this question.
please.
Just when you started this giving nutrition to my patients, like what I feel, I was feeling, and I just thinking about this integration of this all our allied medicine or therapy. जब आपने स्टार्ट किया था न्यूट्रिशन देना पेशेंट्स को तो somehow my patient breast cancer especially breast cancer patient female patient whom we treating and they are undernourished patients and I feel that उनमें से कुछ लोगों ने उनको quit कर लिया therapy को because toxicity because of they are not tolerating very well this chemotherapy because I am a medical oncologist and I do all kind of chemotherapy immunotherapy and everything so quit हो गया and my dropout rates are very high and suddenly when I just handled this my patient to Sanjeevani people Archita and देखा कि उसके बाद तो उनकी dropout है and they are feeling very well and they don't have much more toxicity and they are tolerating very well these drugs because of nutrition because of psychotherapy because of yoga and their positive attitude and their positive जो उनका environment and what yoga kind of environment they have taken really and they are doing well and this convert into like good response rate and also timely completing my therapy of these patients. So this is very important alternative medicines and really it's the unmet need that now we should not only think we should use this and should integrate this all complete alternative medicine and therapy in our practice also from day one from the patients in this patient's treatment. Second important point there's just कुछ patient जैसे like for example मेरे पास आते हैं जिनको constipation and I tried at my best liquid paraffin this and that works not very well. Sometimes the patient may not respond to this treatment or sometimes they may have altered bowel habits and diarrhea alteration but not good bowel management. So what they do on their own वो practice से मैंने देखा कि they are using this like of alternative like Kaim children herbal medicine like pet stuff and they are doing very well. So again this is not written in our allopathy. This is Ayurvedic medicine, which is time tested, and they are also doing very well without any side effect and addictions of the disease. That's why, and again, cannabis, which is also now approved for patients who are cannabis, who have severe interactive vomitings, and they are also supporting to our treatment and diabetes treatment. So it's very important that now this is the high time we should integrate all these therapies day one from in the patients and they are also proven therapy. अभी हमारी discussion हो रहा है कि what is the latest treatment in the world is the immunotherapy. Sir has just recently just told us. So what is immunotherapy? Immune boosting. Just to boost our immunity immunotherapy like what we are using is time tested and underwent clinical trial and shown that there is very good results over this chemotherapy and everything. What is this immunotherapy? Just they sensitize our own cell, T cell, lymphocytes to just check the cancer and recognize the cancer as a foreign particle. तो अपने योगा अपने लास्ट जब हमारा एंशियंस जो थे उन्होंने क्या कहा था अपनी इम्यूनिटी बूस्ट करो सेम थिंग वी आर सेइंग इम्यूनिटी बूस्ट व्हाट यू हैव आल्सो टोल्ड अस इम्यूनिटी आपकी डाउन होगी कैंसर सेल वो इंक्रीज होगी बट हमारी क्लिनिकल ट्रायल्स स्टडीज इन दैट्स व्हाई दिस इज अनरेगुलेटेड आयुर्वेदा या फिर ये तो इनकी ट्रायल्स सिस्टमिक हो जिससे कि हम कम से कम पूरे रेस्ट ऑफ वर्ल्ड को भी ये सेम थिंग हम समझा सके कि यस this is the treatment, this is like haldi turmeric is the treatment which can increase the effectiveness of your treatment and can increase the results in the treatment. So, as you know, 70 to 80% cancer are lifestyle disease. And breast cancer, like for example, why it is increasing? Because of increasing elevated level of estrogen level in the body. And it can be increased by stress also. Estrogen, what stress do in our body? Stress increases the cortisol level. And cortisol level, which can be converted into estrogen level from our adrenal glands, which can be converted and may have this negative impact on overall incidence of increasing incidence. So positive impact also. That's why it's not tested, but somehow we can think of this because why it's happening in the world, why it's increasing because of lifestyle disease. Because estrogen level is high, if a patient a persistent estrogen level high, they will get the breast cancer. Increase the risk of breast cancer. Either it is because of late childbearing, because of overfunctioning of ovaries, because of increasing obesity, have to convert cortisol level into estrogen, and also alcohol and smoke.
Sorry. Yes.
Yeah. Yes, sir.
No, I'm okay. Please complete the conversation.
Okay, coming to cut short my story, coming to your question.
It's not your story.
So coming to question, like how we should tell the patient of prognosis. What I do in my practice. So if patient discuss sudden stage 4 cancer, for example, for the worst cancer is pancreatic cancer and gallbladder cancer, which are only survival for stage is 6 to 8 months. Whatever you do, unexpectedly patient may live up to 2 to 3 years, and really 1 to 2% patients who can enjoy the life up to 5 years. So ऐसा patient जो आता है मेरे पास, तो what is our ethics? Ethics say that you should upfrontly tell the patient and their relatives about the prognosis, about the treatment, and you should discuss everything with them, patients also. But in Indian setup, you all know and we know. Because ये जो ethics है ये अपने western world के ethics है. वहाँ 80% patients का जो diagnosis है, that diagnosis जो फर्स्ट और सेकंड स्टेज में होता है. स्टेज 3, स्टेज 4 का जो उनका डायग्नोसिस है बहुत लेस है इन सब डिजीज का. तो वहाँ वो उतनी फेस नहीं करते चैलेंज कि हर किसी पेशेंट कैसे डिस्कस किया जाए. बट इन इंडिया सेटअप 70-80% कम्स इन स्टेज 3, स्टेज 4. सो व्हाट आई डू, समटाइम पेशेंट डोंट अंडरस्टैंड इन पुअर पॉपुलेशन, तो उसमें तो बड़ा इजी रहता है. ठीक है, जैसे डिस्कशन हुआ जो रिलेटिव से उनको समझा दिया, ट्रीटमेंट हो जाता है. ओके, वो इतना बोधर भी नहीं करते इलिटरेट पेशेंट. बट जो एजुकेटेड पेशेंट है, जो हमारे अर्बन पेशेंट जो हाईली एजुकेटेड से आते हैं, सो आई जस्ट टेल देम द प्रोग्नोसिस सिंपल वे में. डोंट वरी, कोई ऐसे चिंता की बात नहीं है. अभी फर्स्ट टाइम अगर आप कुछ भी बता देंगे तो सुसाइड कर लेंगे पेशेंट. क्या आपने बताया कि आप 4 महीने 6 महीने बचेंगे, वो कहेगी डिप्रेशन में, डीप डिप्रेशन, फर्स्ट ऑफ डिनाइल, बिकॉज देयर आर 4 स्टेजेस. साइकोलॉजिकल डिनाइल फेज या फर्स्ट डिनाइल. मुझे क्यों हुआ, मुझे नहीं हो सकता, ये कैंसर मुझे नहीं हो सकता, मेरे को आप एक बार दोबारा चेक कर लीजिए, आप ये सब कर लीजिए. फर्स्ट डिनाइल होता है, सेकंड इज एक्सेप्टेंस होता है, एंड ये फेजेस है अपनी साइकोलॉजिकल. तो डिनाइल फेज में आता है फर्स्ट फेज. व्हाट हैपन, तो वो सडन अगर आप बताते हैं कि कोई इश्यू नहीं, चलो ठीक है, आपको ये डिजीज है, मतलब अपना डायग्नोस हुआ है, स्टेज क्या है, तो इमीडिएट हम स्टेज नहीं बताते, अपन कुछ टेस्ट करेंगे. हम टेस्ट करते हैं, आइदर टेस्ट हमारे पास है, हम स्टेज में स्टेज लेकर आए सिटी स्कैन पर. समहाउ आई जस्ट पोस्टपोन दिस क्वेश्चन, लीडिंग क्वेश्चन, कि कैसे इसको पोस्टपोन करना है, बिकॉज उसके बाद उसकी थिंकिंग स्टार्ट हो जाएगी.
तो ग्रेजुअली कर लेते हैं. Which is nice. Actually, Dr. Jasuja was talking of the prognosis. I'm no doctor. I know nothing about medicine or anything like that. But I know one thing. That there is one prognosis in life for all of us, which is we do not know what will happen in the next moment. For people who have cancer, for people who do not have cancer, there is only one prognosis. So we need to live this life as healthily as possible, as joyfully as possible, and do things which we believe in, which we enjoy doing. And I really hope that we are able to take this conversation further and it doesn't finish with the panel discussion here. And thank you so much.